So in the previous video, I have already given you a vague idea about the MDM table, the big MDM table. So there are 4 levels of MDM, which is straightforward level, low level, moderate as well as high level. So in order to identify the level of MDM, which is not directly given in the question, we need to consider 3 factors. First one is number and complexity of problem addressed. Second element is amount and or complexity of data to be reviewed. And third one is risk of complication and or morbidity of mortality of patient management. Okay, so these are the 3 elements which depends on it will be in which level of MDM. Okay, which decides. Okay, so the first element of MDM, number and complexity of problems addressed, is explained in detail in this video. Okay, so here I have given a very small portion of the big MDM table. Okay, in your textbook you are having a big MDM table where each element is explained separately. So I have taken the first element, the number and complexity of problem address, that portion alone, and placed it here. Okay, so what all things you have to identify in number and complexity of problems addressed. So when you get a question, there will be definitely a chief complaint, a complaint presented by the patient. Okay, so we have to note down all the problems that is presented by the patient, his personal history, then the diagnosis which is made by the physician. All these problems we need to identify, and we need to decide it comes under which category of the problem table. That is whether it comes under minimal or low or moderate or high. Okay, so how to decide that a particular problem comes under minimal, low, moderate or high? That is given there. So in the minimal heading, you can see one subpoint, one self-limited or minor problem. That is, if the patient is having just one minor problem or one self-limiting problem, means we can take in the problem table as minimal. Okay, next, low. Low, there are 4 points. 2 or more self-limited or minor problems, or one stable chronic illness, or one acute uncomplicated illness or injury, or one acute uncomplicated illness or injury requiring hospital inpatient or observation level of care. So if any of the 4 is met, means you can take it as low. Okay, so we want to understand what is this self-limited minor problem, what is stable chronic illness, what is acute uncomplicated illness, like that. What are they? You need to understand first. Then only we can take we can identify that a particular problem comes under which section, minimal or low or moderate. Okay, so first I will explain that what is self-limiting problem, stable chronic illness, acute uncomplicated illness. Then I'll come back again to this table. One by one. First one is self-limited or minor problem. Self-limited or minor problem means, self-limiting means it will heal by its own. That is the meaning of self-limiting. Minor problem means very small problem. Okay, so problem that runs a definite and prescribed course, transient in nature, not likely to permanently alter health status. So a particular condition which will be only there for a fixed amount of days, and after that it will be healed or resolved by itself. That is called self-limiting problem or minor problem. Okay, it does not cause a permanent change in the patient's health status. Example, a common cold. A common cold may last for 5 or 6 days, and it will heal, it will resolve its own, right? Similarly, an insect bite without any complication, if it is a normal insect bite, means it will heal its own. Okay, such conditions, such cases are called what, self-limited or minor problems. Okay, they will run a definite course, and after that it will go its own. Then next one, stable chronic illness. So disease conditions can be classified into 2 categories, acute illness as well as chronic illness. Okay, so what is the difference between acute and chronic? Acute means they are recent in onset. Okay, condition, it occurs suddenly and it lasts for some time, and after that it lasts for just a short time, and after that it will be resolved. Such conditions are called acute condition, whereas a chronic illness means they are actually a long developing condition. Okay, which means this a particular condition is not suddenly occurred, it gradually developed in the patient in a long time. Is given stable chronic illness, a problem with an expected duration of at least 1 year or until the death of the patient. So a stable chronic illness means a condition which have occurred for at least 1 year, and it may last even it may be lifelong condition, that is it may last until the death of the patient. Okay, example, well controlled hypertension. Hypertension means increased blood pressure. Okay, so the patient is having increased blood pressure and he is taking medication for the same, so that the hypertension is well controlled means it is a stable chronic illness. Okay, it will never go its on. Okay, similarly diabetes, non-insulin dependent diabetes, then cataract and benign prostatic hyperplasia. These are some examples of stable chronic illness. So if you are a non-medical background student, I am giving so many examples for each conditions. Like I have given example for self-limiting problem, stable chronic illness, acute uncomplicated illness or injury. So note down those examples. Okay, which means well-controlled hypertension comes in stable chronic illness. Please note it down, because at least if you get question of the same condition, you can easily identify. When you get a question about cataract means, you can identify, yes, it is a stable chronic illness, like that. Okay, so please note down this in the textbook or notebook or somewhere. These examples comes under which category. The next one is acute uncomplicated illness or injury. So I have already told what is acute. Acute means a recent short-term problem. Uncomplicated illness or injury means low risk of morbidity for which treatment is considered. So it is a recent short problem, a short-term new problem for which if proper treatment is taken means the problem will be resolved. Okay, such conditions or injuries are called acute uncomplicated illness or injury. Some examples are given here: cystitis, allergic rhinitis, simple sprain, all comes under acute uncomplicated illness or injury. Next one is chronic illness with exacerbation, progression or side effects of treatment. So we have already explained about stable chronic illness. What was stable chronic illness? A long-standing condition where there is no complications. Okay. But what if the patient had a long-standing condition and currently that particular condition is worsening or it is poorly controlled, means it is called a chronic illness with exacerbation. Okay, but it still does not require consideration of hospital level of care. Hospital level of treatment is not needed for that particular condition. Example given here is COPD with acute exacerbation. So COPD means it's a chronic condition, chronic obstructive pulmonary disease. Okay, so if the particular patient, the particular COPD patient is having now symptoms of exacerbation of the condition, means you can categorize it under this heading: chronic illness with exacerbation, progression or side effects of treatment. The next one is undiagnosed new problem with uncertain prognosis. A problem in the differential diagnosis that represents a condition likely to result in a high risk of morbidity without treatment. I'll explain with an example. A patient came to physician with a lump in the breast. Okay. The physician palpated or touched the lump in the breast, and he made many differential diagnosis. Differential diagnosis means it is not a final confirmation. Okay, the final confirmation or diagnosis can be made only after the result of a USG or a mammogram and all. Okay, so before making final decision, final diagnosis, he have made some assumptions. That is, it can be a cyst, it can be a tumor, like that. Okay, so these assumptions are called differential diagnosis. Okay, So such condition where a final diagnosis is not met, only a differential diagnosis can be made. Such conditions are categorized in this undiagnosed new problem with uncertain prognosis. Okay, what is prognosis means? The final outcome of treatment. Okay, so just a lump in the breast which is not diagnosed, where the final diagnosis is not made, so the treatment is also not finalized. In such case, you can classify it under undiagnosed new problem with the uncertain prognosis. Then next one is acute illness with the systemic symptoms. So the patient is having a condition which occurred recently, a short new condition, but the patient is having many systemic symptoms and the condition is having high risk of morbidity without treatment. Okay, the systemic symptoms does not include fever or body pain like that. The systemic symptoms means an example sepsis. Okay, sepsis is a systemic symptom. So if such case occur, you can classify it under acute illness with the systemic symptoms. Example, pyelonephritis, pneumonitis, colitis are some examples. Then next, acute complicated injury. An injury that requires treatment that includes evaluation of body systems that are not directly part of the injured organ. The injury is extensive or the treatment options are multiple and or are associated with the risk of morbidity. So we have already seen acute uncomplicated injury. What was that? A recent short new problem for which the treatment is minimal and once you take the treatment it will be resolved. Okay, then what is acute complicated injury? Complicated injury means somewhat complicated, recently occurred condition where we require evaluation of other body systems which are not directly involved with an injured organ or which require extensive treatment options or where there is an increased risk of morbidity. All such categories can be classified into acute complicated injury. One example is head injury with brief loss of consciousness. So patient is having a trauma to head and his consciousness have been lost for some time, means it can be due to many reasons. So to brain injury, okay, so it can be identified only after evaluation of body systems. So such examples are categorized under acute complicated injury. Next one is chronic illness with a severe exacerbation, progression or side effects of treatment. So we have already seen chronic illness with the exacerbation. What was that? A chronic stable condition. Suddenly its symptoms aggravates or it is poorly controlled. Okay, but does not require hospital level of care. That was chronic illness with the exacerbation. Now the chronic illness with the severe exacerbation means it require hospital level of care. Okay, a stable chronic condition, it suddenly increased or its symptoms worsen or it is poorly controlled and it require hospital level of care means we can classify it as chronic illness with a severe exacerbation. Then last one, acute or chronic illness or injury that poses a threat to life or bodily function. So it can be an acute condition or a chronic condition, but that particular condition is life threatening or threatening to a bodily function. Functioning of body means it can be classified under this category. Okay, so without treatment it will be life threatening, means you can categorize it under this category. Many examples are given here. You need to note that. Okay, so that it will be helpful for you while doing questions. Example, acute myocardial infarction, pulmonary embolus, severe respiratory distress, progressive severe rheumatoid arthritis, so and so. So now we understood what is one self-limited or minor problem, what is acute illness, acute uncomplicated illness, what is stable chronic illness, what is chronic illness with exacerbation, severe exacerbation, undiagnosed new problem, all we have seen now. Okay, so first make clear that you are confident with all those and then come to this table again. Okay, so in the minimal section, the first heading, minimal section, we can see one self-limited or minor problem, which means if the patient is having just a common cold alone or if the patient is having just an insect bite alone, means we can consider it as one self-limited or minor problem, and we can take it as minimal in the problem table. Okay, similarly in low, two or more self-limited or minor problem. That is, if the patient is having common cold as well as fever, or if the patient is having insect bite as well as common cold, then there are two self-limited problems or minor problems. In such case, you can take it as low. Okay, then one or is given there, one stable chronic illness. That is, if the patient is having well controlled hypertension only, you can consider it as one stable chronic illness and you can take it as low in problem table. Then next, one acute uncomplicated illness or injury. That is, if the patient is having allergic rhinitis alone. Okay, then you can, it is an acute uncomplicated illness or injury, then you can consider it as low in problem table. Okay, then moving on to moderate. One or more chronic illness with exacerbation. That is, if the patient is having COPD with exacerbation. That was an example for chronic illness with exacerbation. Then we can take it as moderate. Okay, then what is the second point? Two or more chronic stable illnesses. Which means if the patient is having hypertension as well as diabetes, they are two stable chronic illness. So we can consider it as moderate. Then or one undiagnosed new problem with uncertain prognosis. That is, if the patient comes with a lump on the breast, we can take it as one undiagnosed new problem with uncertain prognosis, and we can consider the moderate. Okay, so in high, next high, one or more chronic illness with severe exacerbation. If the patient is having one or more chronic illness with severe exacerbation, or one acute or chronic illness injury that poses a threat to life, means you can consider it as high. Okay, so whenever you get a question where MDM is not directly given, means identify all the problems that is mentioned in the question. Then you categorize it. It comes to which category? These problems comes to minimal or low or moderate or high. Okay, if there are two minimal problems as well as two stable chronic illness, means two minimal problem comes under low, but two stable chronic illness comes under moderate. So you need to take the higher one, moderate. Okay, that you have to keep in mind. So identify the problems and categorize it comes under which level of the problem table. Okay, and then you go to the next data table. Okay,